and Prevention Medical Director for Intermountain Employee Health. Dr. Carroll will give us a kind of a brief overview. Then we're also pleased to be joined by the Utah legislators from the Southern Utah area, Senator Don Ipson, Senator Even Vickers, Representative Walt Brooks, Representative Brad Last, Representative Travis Signeller, Representative Rex Shipp, and Representative Lowry Snow. Each of these gentlemen will give a brief comments after Dr. Carroll. Then we'll have Dr. Dascom give us an update on the vaccine rollout and how that's going, and then we'll open up for questions. So we will be recording this as we typically do, and I'll provide those that recording and the links afterwards. But let's go ahead and start with Dr. Carroll.
Excellent. Thanks, Lance. Thanks everybody for joining us today, and especially like to share my thanks and gratitude for our local legislators that are here to join with us as we share a message about COVID with the community. First of all, I'd like to thank the community for the efforts that are underway that people are doing to decrease the spread of COVID. Let me focus on one particular thing. We all anticipated there would be a surge in COVID cases after the Thanksgiving holiday. And we're pleased to see that surge that we expected didn't occur in the way that we thought it would. And that tells me that we have a significant percent of our population in Southern Utah that did follow the recommendations of our government officials, of our healthcare officials, and of our local mayors as we met before Thanksgiving, to encourage and ask the community to celebrate Thanksgiving holiday with their individual families rather than the extended families and friends. Thank you to the members of the community that did that. Thank you to the members of the community that followed those recommendations, followed that advice, so that we can prevent hospitalizations and prevent negative outcomes among some that we are seeing that do get COVID. What you're doing is making a difference, and that's really, really important, and we're extremely grateful from the hospital standpoint. And our goal is to help everybody live the healthiest life possible. I want to take just a minute as well to share some information about COVID testing with the Intermountain testing site. And there will be some limited hours during the Christmas holiday and New Year's holiday. And if we haven't sent this out already, I'm sure we can send it to you with specifics. But Christmas Eve, the Southwest Utah sites will open at the regular times on Thursday, December 24th, and they'll close at noon. On Christmas Day, all of our Southern Utah testing sites will be closed. The day following Christmas, on the 26th of December, all sites will have regular hours on December 26th. Then on New Year's Eve, will be regular hours, but New Year's Day, the sites will be closed. So no Intermountain testing sites in Southwest Utah open on Christmas Day and New Year's Day. We will be open Christmas Eve and the day following Christmas, and limited hours on Christmas Eve. And those are all available on the Intermountain website, intermountainhealthcare.org/COVID testing. From a hospital standpoint, it was a bit sobering this morning when I checked our COVID numbers, and unfortunately we once again set another record number of hospitalizations, with 67 COVID positive patients admitted to the hospital in St. George. Our ICU census, we've shared with our local media that our ICU, we have 32 ICU beds. We currently have 37 ICU patients, which means that we continue to have ICU patients outside of our regular ICU and being staffed by ICU nurses. So, we're continuing to find ways to treat each patient that needs care in the hospital. But we also need to recognize that this is contingency care, that we're not providing the normal care for ICU patients in the normal place that we would would like to provide the care. Somewhat sobering as I continue to follow our hospitalizations and some of our metrics here in St. George, is we have seen some ups and downs in the number of hospitalizations. Overall, the trend of hospitalizations has been down, notwithstanding today our number is the highest that it's been. Our overall 7-day average is not at the highest level that it's been. We see a trend where the number of cases increases, followed by the number of hospitalizations that increases, followed by a number of ICU COVID hospitalizations increasing. And unfortunately, that's often followed by an increase in the number of COVID deaths in the hospital from our COVID patients. Last week, as I tracked our numbers and followed those along, we exceeded an average of 2.5 inpatient COVID deaths per day for a rolling 7-day period. That's a pretty humbling statistic. It's something that we were worried about as the cases increased. We were worried that this is something that may occur. We were hoping we continue to do everything we can to prevent any death, whether it's a COVID-related death or otherwise. Despite the best efforts of our team and the excellent care that our ICU physicians and nurses and respiratory therapists provided, we continue to have patients and individuals, our friends and neighbors in our community, that are not surviving their COVID illness. The work that's being done to prevent spread of disease will translate into decreased hospitalizations and will translate into decreased deaths. I do want to, you've heard before, and I'll reiterate that our caregivers are, particularly the nursing staff, is exhausted in what they're doing. We've brought in extra help. We appreciate the extra help, but they're committed. They're committed to providing the best care they can to every single patient in the hospital. We'll continue to do that. Let me just finish with one more statement of appreciation, not just for the community, but to our elected officials that are on this call. Nearly every elected official on this call has accepted the invitation to come and tour the hospital with our leadership team to see firsthand the impact of COVID in the hospital. They've asked very good questions. They've sought clarification on items that have been floating around in the community, and we really appreciated the opportunity to have those conversations. And we appreciate how sincerely our legislators care about the local community and our state community as we continue to work through this pandemic. So just sincere gratitude to our elected officials as we partner together and to do this work. And I'll pause there and Lance, transition back to you for introduction and statements from our legislators.
Thanks, Dr. Carroll. Okay, let's go ahead and start with Senator Don Ipson, and then we'll have Senator Evan Vickers after him.
Good afternoon. I'm pleased to be with you folks and share a few minutes with you. This is a troubling time that we've been through, and we've worked hard to. President Adams, the president of the Senate, is kind of led out with this from a political standpoint to help guide a process that kept us so that we were healthy, but yet didn't shut the economy down. And I'm grateful to him for the input he's had. But they mentioned that we toured the hospital, and that was pretty sobering for me. It was to see the the intensive care unit expand into the other areas and the other wings of the hospital, and the statistics are using those beds today. What an incredible job the hospital has done to help us through this. It comes close to home. I have two granddaughters. One is a respiratory therapist, and one is a ER nurse. And, it's pretty sobering to see those guys, and humbling, scary to see them working with that every day. And it's, early on and through the summer, I don't know that I knew anybody that had COVID. And now, today, I've had several friends that have died from it, acquaintances, and I know a lot of people that have had it and that have been hospitalized. And I'm thankful for the great hospital care we have in our area and this state, and thankful for those people that are giving the service. We need to be cautious as we go into Christmas Day, that we, 30% of the places where this COVID is transmitted to other people is in our homes. And we need to be protective of our health in our homes. But I just leave with the folks in the hospitals, what an incredible job they've done, how dedicated they are, and the long hours they work. They suited me up with a COVID outfit as they moved in and out of these rooms, and how they put this on and take it off many times during the day. It's just really an incredible. Dr. Carroll, thanks for your staff for how incredibly dedicated they are to the people of Utah. Thank you.
Hi, I appreciate the opportunity to be with you today. I'm like Don, that, I echo the thanks to our legislative leadership, both in the House and the Senate, and the executive branch with Governor Herbert and his staff. But more importantly, here in Southern Utah, our medical people. And I'm a medical professional. I'm a pharmacist. We own 3 pharmacies, 2 in Cedar, 1 in Ridgefield. And one of our pharmacies is now doing the rapid testing. And so we've been involved with that. So it's been interesting for me to be involved on a number of different fronts. I sit on the hospital board here in Cedar City. I'm a pharmacist. We're involved in the treatment of patients. And then also being a legislator. So, it's been quite involved, and it's really been busy. I've tried to become a little bit of a COVID nerd, trying to learn as much as I can about the disease and about other things that are going on, and some of the things that are being tested, some of the philosophies and some of the theories that are being tested. And it's really been intriguing to me. But like I say, I've been through the Cedar City Hospital a number of times because I'm here. We don't have a trauma center like they do here in Dixie with, St. George Hospital. But, and so it was a really good opportunity for me to get with Dr. Carroll, who's a family friend, and to go through the hospital down there and look at it. There's two takeaways that I had from that. One is the toll it takes on those caregivers. And Dr. Carroll talked about the fact that when a patient passes away in the hospital, oftentimes that caregiver, that nurse and the physician, are the only ones there. Family usually can't come in, and so they're there with that patient when that patient passes. And also what a strange disease it is that a person can be coherent and talking to you, and 15 minutes later actually be dead. And the other thing, it's been such a strange political climate around COVID, whether it be about wearing a mask or all the theories that you hear, and these conspiracy theories that every patient is being coded as COVID so the hospital can get more money, and I asked Dr. Carroll about that, and he said, well, we do get a little bit more. I think it's $30-40 a day from Medicare if that patient came in specifically for COVID. But if it's a secondary source, then no. But he says, put this in perspective. At the time that I went through, and he mentioned they have 32 ICU beds, but they had 47 ICU patients. And he said we had to convert one of our orthopedic wings into an ICU for COVID patients. And he said, now if you compare the money we get from a COVID patient versus the money we would get off of that per bed off of the orthopedic wing, it's not even close. It's 4 or 5 times more with orthopedics. So, you know, it's been frustrating in a lot of ways to see the various theories with social media and other things. The disease is real, but I think that we need to keep a balance in our life, make sure that we're keeping the economy open and keeping people thriving and still going that way, but then also being protective. And so in our businesses, we have retail businesses, and I appreciate the fact that just very seldom do you ever see a person come into our store without a mask on. And so I think that backs up what Dr. Carroll said in his opening statement, that it does appear that people in Southern Utah are being more careful. So thanks to everybody that has been involved in this, especially with our hospital caregivers and others that are on that frontline care, whether they be in a nursing home or whether it be home health or whether they be in the hospital. So thanks. I don't know, Lance, if it's back to you. If it is, you're on mute. So.
Yeah, the comment of 2020, you're on mute, and I was so eloquent too. So apologize. thank you, senators. Now we'll go to the representatives. Let's start with Representative Brooks. Then we'll go to Representative Last, Representative Segneller, Representative Shipp, and Representative Snow.
Well, thank you for the opportunity to be here. I think the senators really articulated the situation well. So I just want to take a minute and have you tell your staff and personally tell each one of you, thank you so much for what you are doing. No matter what people think or say, the reality is that you're in the trenches and you're working hard. You're seeing the pain that's coming across people who are struggling with COVID, especially those that are suffering enough that they have to be in the hospital or struggling to breathe. I can't imagine that type of feeling or situation. So thank you for all of you and what you are doing. And thank you again to the administrators who are open and honest with us as we have questions come from constituents that question some of the data, that we're able to go and double check and get real answers and take the time to understand the situation better. So thank you very much, and hope you all can have a Merry Christmas even in this time of struggle. Thank you.
Yeah, I'll join with everybody else and say thanks for the chance to be here. I'm not sure how much we can help going into the Christmas season, encouraging people to do what they can to help protect others, but whatever we can offer, we're happy to do that. I'd also like to just recognize a few people and express gratitude for them, I guess groups of people really, because I think they've made such an amazing difference to our state during this really challenging time. First of all is the educators, both public and higher ed. I mean, we've been able to keep our schools going during this pandemic. And I know that it's put an incredible amount of pressure on the teachers and on the staff at the schools. And I just want to say thanks to all of them. Of course, I work at Dixie State University. I've seen it up close and personal. And we've tried to stay open and keep our students in class as much as possible. And I know that that's been an incredible effort on the part of hundreds, thousands of people really throughout the state. Also want to recognize businesses. I know many businesses are really hurting, but it's been amazing to me to watch how businesses have adapted during this challenging time. I mean, there have really been some unlikely businesses that have been thriving during this period of time. And I think it's been amazing to watch the human ingenuity as people have tried to continue to serve their customers and the population of the state through their businesses. And I just encourage them to stay with it and to keep being creative and do what they can to support the economy in the state. My colleagues have talked about healthcare workers, and boy, we really can't say enough about that. Of course, I come from a family of healthcare workers, and None of them have been too directly impacted because they're not working in the emergency room or in the ICU, but certainly we've had our connection to it indirectly through them. And like my colleagues, I had the chance to go through the hospital and just see firsthand what that looked like. And on the orthopedic floor, which has been converted into ICU beds, ran into a family friend, a young man who's a nurse, and just had the chance to ask him, tell me about a given day in the hospital and what's it like. And as others have said, he talked about the challenge, the emotional challenge of working in that situation, not only putting on the gear every time you have to go in a room, but really being the contact that patient has with the outside world. If a family wants to talk to that patient, they go through the nurse, and the nurse is trying to interpret back and forth, especially for those patients that can't talk, trying to set up FaceTime or Zoom or whatever, so they become technologists as well. And I just want to express my gratitude from the administration all the way to the aides that are in the rooms and working with the patients. Thank you so much for what you're doing. We really appreciate that. And want to just say thanks to the citizens, especially of this area, who are doing what they can to help. That's been mentioned by my colleagues as well. I've been able to avoid COVID, and to whatever extent that's been because the people around me have been careful. I just want to say thanks to them, but really thanks to our society. And I thank you on behalf of my 8-year-old granddaughter that has cystic fibrosis and who is really at risk if she has a problem with her respiratory system. I thank you on behalf of my mom, who's 88 years old and who we need to see to take care of, and on behalf of all of the other people who have any kind of health risks. What we as a society are doing is helping, and the little things that you do to try to protect yourself and others can be beneficial. As my colleagues have said, this is real. I had a neighbor recently who went into the hospital, was diagnosed with lung cancer on Monday, and died of COVID-related illness on a Thursday. And you know, those kinds of things are hard to see. And I just want to express my gratitude to all of those who are doing what they can to make the situation better for those who are ill and for those who are helping to keep everybody safe. Thanks.
Thank you. Just looking, I don't see Representative Segmiller. If you're there, go ahead and speak up quickly. Okay, he probably wasn't able to join us last minute. If Representative Shipp would like to go next.
Yes, thank you for this opportunity, and really grateful for the opportunity I had of taking the tour of the hospital there in St. George with Dr. Carroll. Dr. Carroll grew up around the corner from my family, and so we know his family very well. Wonderful young man. And it's been an interesting dynamic over the last several months. I know when this initially happened and masks and things were recommended around Cedar City, we didn't see a lot of people really complying with that and didn't think it was necessary. But even just today, as I went for lunch, and recently I've noticed, and I'm grateful for these community members that are wearing their masks and social distancing. That will really help. It's a sobering thing. My family, had been planning for the last almost year to get together, everybody, for Thanksgiving. I have a son that lives in Washington, D.C. I have a daughter and her family that live in Oregon, and then most of the rest of them, besides the one that lives at home with us, that I have 4 that live on the Wasatch Front. And so as it came close to Thanksgiving, and we decided, and everybody decided, well, we better stay at home so that we don't run the risk of spreading this to family members and those around us. And so it ended up being my wife and I and our one son that's just graduated from SUU. We spent Thanksgiving together, the 3 of us, and And so it was not what we wanted or anticipated, but I am grateful that my own family and my kids decided, hey, we need to do our part in helping to control this pandemic. So I'm grateful for them. I'm grateful for the community members that have stepped up and are doing their part. And I know there's through social media, there's those naysayers out there that are saying that, you know, this is an infringement on our freedom. You know, this isn't that critical. I'm glad that most of the people are not listening to those things. I was sobered. It was a sobering thing when I went to the hospital and saw that at that time, a couple of weeks ago, it was 99% full. COVID, the ICU was 150% full, and it really makes you realize that it's a real thing, and appreciate all the healthcare workers and their efforts. And a lot of them I know are very exhausted from what they're doing, and that they are doing it in a wonderful way. So with that, I just want to wish you a Merry Christmas. Grateful for the leadership of the House. Speaker Wilson has done been very involved and done some things, as well as the rest of the leadership in the Senate as well. And we appreciate all of you, community members. We appreciate you, hospital workers, and what you're doing. So thank you for letting me say a few words.
I guess it's my turn. Let me also begin by thanking Dr. Carroll and those who you work with for calling this event and allowing lawmakers to speak. And thank you, Dr. Carroll, for giving us an opportunity to tour your facility, the hospital. Like everyone else who has spoken today, when you actually see it, and you talk to the medical providers, those that are working there, and you find out to what lengths we've had to take in our community to provide for those who are ill and suffering from this, it is sobering. And also, as you count the numbers we've lost in our state and in southern Utah, and some of those represent people that we know. It's real. And the pandemic has taken people's lives, and we need to continue to be vigilant. Lots of folks, or lots of my colleagues, have conveyed thanks to our frontline providers, our medical providers. I would like to express my thanks as well to everyone that has helped contain this pandemic, but especially today. I want to thank the people in the community in southern Utah and all over the state, but southern Utah where we see it. I've noticed, like Representative Shipp, that there seems to be a change in the climate and the attitude. I see more people willingly put on their masks. I see more people willingly to make sacrifices. This was a hard Thanksgiving for my wife and I, because this was supposed to be the one in rotation when we had all of our 6 children, all of the grandchildren, and there's nothing quite like getting everyone under your roof on Thanksgiving for Thanksgiving dinner, and giving that up and sacrificing that was hard, but we too felt like that it was a sacrifice that we needed to make to do our part. And I know we weren't alone. I've talked to so many families, so many parents who did the same thing. I talked to so many elderly people living in my neighborhood who expressed some sorrow of being alone for Thanksgiving, but at the same breath said, we wanted to do whatever was necessary to do our part. So I express sincere thank you to the citizens who have stepped up. And Dr. Carroll, you were correct, I think, when you said you anticipated a surge after the Thanksgiving holiday. We talked about that when we toured the hospital, and you showed us what arrangements were being made to accommodate that surge. But I think it was because of citizens stepping up and trying to do the right thing that helped us contain that in a way that we perhaps didn't anticipate. last thing I want to say is what a great miracle that we are now looking at people receiving the vaccine in our country, in our state. And to think that this has been accomplished within less than a year's time is nothing short of a miracle. And I think we owe a lot of gratitude to, in my opinion, to help on high, divine help in helping us to meet this challenge. So there's light at the end of the tunnel. But as I've talked to so many people, our leaders, and those involved in the hospital, we can't let down our guard. We need to remain vigilant until we can all receive the vaccine and all be protected. And I'm confident that we can do that through the Christmas holidays, through the holiday season, because that's the kind of commitment I think that we receive from our citizens. So with that, and with a sincere comment of appreciation to the citizens that have stepped up and who have done their part, I just can't tell you enough how much we appreciate that. And there are thousands of people who we will never know who have been benefited by our willingness to make sacrifices. They didn't get sick. We didn't lose a loved one. And we just need to continue to be vigilant. Thank you for allowing me to make a comment or two.
Thank you to each of you. I believe Dr. Carroll had a couple last comments, and then we'll go to Dr. Dascom. Dr. Carroll, you're muted.
Thank you, Lance. Appreciate you catching me on that. Appreciate the opportunity to have it take just a couple more minutes. I'd like to express my appreciation to Dr. Blodgett and the Southwest Utah Public Health Department. They are putting in a tremendous amount of work that really goes unnoticed. Virtually all of it, or much of it at least, behind the scenes that we don't see occurring. And that's important work that continues. So thank you to Dr. Blodgett and his team. As Ben mentioned, we have converted different beds in the hospital to different type of care for COVID patients. Our 32-bed ICU has expanded onto the same floor into other ICU beds. Our orthopedic unit on the fourth floor has been converted into an all COVID unit currently, where patients are being cared for. In addition to the COVID patients that come into our labor and delivery unit, our behavioral health unit, that we're taking extra precautions for, while not treating COVID directly per se, but managing COVID for those patients with their other disease processes that are ongoing, or other conditions that we're treating. I would simply like to end by asking you to join me in continuing the work that you're doing. Join me in your Christmas celebrations like you did for Thanksgiving, to enjoy those with your immediate family, and we can have a wonderful Christmas as well. Lance, I'm going to take the liberty, if it's okay, to introduce Dr. Dascom. Dr. Dascom has done a phenomenal job. I'm so happy to be able to work with her, an infectious disease specialist and a physician within the Intermountain system that has led out on infection prevention and employee health, and helping to keep us and our patients and our community safe. We are extremely lucky to have her. And Dr. Dascom, over to you. And you two are on mute, Dr. Dascom.
Amazing how that works. I'm apparently not good enough to match the wits with technology, but thank you so much for that very warm introduction. Intermountain Healthcare is grateful to be able to announce that we have now vaccinated approximately 5,000 of our caregivers. This is done by appointment only to ensure that we are creating a safe environment for our caregivers due to COVID, ensure social distancing, ensure that we have everyone accounted for and can get their follow-up vaccination as well. Remembering that we also have to monitor folks afterwards. So we want to make sure we have enough space for everyone to have safety during COVID. At the end of the day, because we are using the Pfizer vaccine, as you may have heard, Sometimes we are able to get extra doses. Our pharmacists are very adept at being efficient and using every possible means to be able to access those opportunities. We have had extra doses affiliated with our vials. And we are also grateful to note that our caregivers have been exceptionally accepting of the vaccine, so much so that at the end of the day, we always have extra caregivers to be able to give those extra doses to. So we are planning on continuing specifically to vaccinate our caregivers at this time, ensuring that we can do that in as rapidly as possible as we can. Rather than having these small amounts go to waste or having to have them be thrown away, we would much rather be able to give access to caregivers that are interested in that access. Over time, we are looking forward to expanding our hospital access to the Moderna vaccine and other vaccines that come along, and getting our caregivers and ultimately our community this type of protection, along with the protection of masking as our community develops immunity together. This may be a while, and we will still need to ensure that we are being protected during that time. To clarify, I apologize for masking, but it is important. I am in a room with other caregivers. We have now vaccinated approximately 5,000 of our caregivers. Thank you very much.
Thank you, Dr. Dascom. And now, as is usual, we'll go ahead and open for questions. If you would please unmute yourself, introduce yourself, and then ask your question. And if it's directed to someone specifically, go ahead and do so.
Hi, this is Chris Reed with St. George News, and good to see everybody again. I'd like to actually start off by directing a question towards certainly either Representative Snow, State Senator Vickers, whoever represents the Cedar City area. We had late October where Cedar City had gone down for a little bit, so the mask requirement was lifted. And leaders have been pushing for the area to, quote unquote, go green back when we had that color system. Then the November surge came, and at this point, Cedar City's new infections on one day equaled St. George's, and they're still experiencing a rise. Was it a mistake to take the foot off the brake pedal in that case? And I don't know if Senator Vickers wants to.
Sorry, I apologize. So, Chris, just give me give me the question real quick again. I heard part of it.
Sure, and not a problem. Well, yeah, basically, late October, the mask requirement was lifted in Cedar City. And I know that, and certainly, Senator Vickers, you were certainly a proponent for a long time of the area going green. And then the November surge came. And I guess I'm asking in retrospect, and we all play Monday morning quarterback, was it a mistake to take that foot off the brake pedal at that point?
No, I think that surge was going to come no matter what happened. I've always been a proponent, and this is just my personal belief. I really don't like mandates. And I, myself and others tend to respond better if we're given a choice. I always like to educate and give people a choice. And I felt like that people were doing that anyway. We were a proponent of going green because we wanted to make sure that our economy was rolling and that people were being treated. No, I don't think it was a mistake, because quite frankly, I think that surge was going to come whether everybody was wearing a mask or they weren't. I think by wearing masks, it minimized it. So at least that's my thought. Rex, you might have a different opinion on that. I don't know.
Yeah, I can just make a comment to that as well. The numbers didn't seem to justify masks at one time, and so I think it was the right call to try and not have it be a mandate at the time. But certainly things have changed in a big way since then, and I think it's pretty important right now to be doing that and wearing a mask and social distancing and so forth. Thanks.
Thank you. Next question.
Hi, this is Haley Hendricks with ABC4 News. This question is for one of our healthcare professionals. So the state of Utah, along with other national research, has created vaccine trackers online for the public to see how many vaccines have been administered daily. So what value do these vaccine trackers add to health officials and that data there, and even the public?
This is Dr. Dascom. I can answer that question. There is a vaccine tracker on our state health department site. It does quantify the number of vaccines that have been administered and reported back to the state. We as a system are supporting that by reporting the number of vaccines we have administered at the end of the day. This also helps us keep in compliance so that the state knows how many vaccines we administer, so that they can supply us with the second dose for our caregivers and ultimately our community. This should help our state with further planning. That helps them know how many caregivers have been administered. They know how many caregivers there are. They also are starting the process of planning each age group, for example, or those with comorbidities, to ensure that we are getting enough vaccine over time, planned ahead. So if they know how much is being utilized, they can plan ahead to ensure that the next cohort is ready for rapid vaccine administration. So I think in terms of the public's benefit, it will ultimately lead to rapid vaccine dissemination and benefit to our community.
Thank you so much for that.
Haley, if I might add to that briefly as well, I think one of the things that we have to be cautious about is we run the risk as a society of seeing that number go up and think that we're safer than we actually are. It's important to remember that the state of Utah has over 3 million residents, and so it's super exciting to see vaccines roll out. And I agree with Representative Snow that this is nothing short of a miracle to have this occur as quickly as it did. When we see 5,000, 10,000, 20,000, 50,000 individuals vaccinated on that tracker as that goes up, we need to put that in perspective. I did a calculation recently for southern Utah, for Washington County, and calculated that we were at 0.25% of our population vaccinated. I'm super happy that occurred. This is the beginning. We're not at the end yet, and so we need to continue to do what we're doing while we work through this process to give everybody the opportunity to be vaccinated that would like the vaccine.
Thank you for sharing.
This is Chris again. If I can follow up on Haley's question, and maybe Dr. Carroll may be more easily able to answer this than Dr. Dascom, but good to see her. Do we know how many of Dixie Regional's caregivers specifically have been vaccinated at this point? And are we getting close to the point? Like, when are we going to be at the point where we feel like, okay, we've got the frontline caregivers taken care of? And I know that teachers were supposed to be next up on the vaccinations. When are we going to be at that point where we move on to the next phase, so to speak, of vaccinations?
Yeah, excellent question, Chris. We in St. George have received, or at Dixie Regional Medical Center, have received 975 vaccinations. As Dr. Dascom mentioned, our pharmacists are able to draw up the right dose of vaccine for more than 5 doses. So we have administered just shy of 600 vaccines at this point in St. George, and those have been given to our caregivers that are at the highest risk. So caregivers that work in the ICU, caregivers that are working with COVID positive patients. That includes physicians, that includes nurses, that includes our environmental services workers that are cleaning the rooms, that includes our food services workers that are delivering food to COVID positive patients. It includes our emergency department and a host of other individuals and groups. And so we've been very deliberate and very thoughtful under Dr. Dascom's leadership and others to have a consistent process as we work through this. I can't tell you, Chris, how many physicians have reached out to me that are not in, that it's not their turn yet, and saying, Dr. Carroll, when do I get my turn? Our physicians have read the research. Our physicians have looked at the data, and they're excited to get this vaccine, and they are getting this vaccine. To answer your question about school teachers and others in the community, I don't have a date, although I know that Dr. Blodgett and the health department is working diligently to get those plans underway. Let me switch hats for a second. My role as a member of a school board here in St. George, we've been in conversations to get the teachers of that school immunized as well. And those plans are underway, led by the health department with Dr. Blodgett and team.
Any other questions?
I have actually, yes, one more, and this will go, certainly, Don, Don Ipsum, you had a very emotional statement where you talked about taking that tour and it being a real wake-up call. What kind of things did it change in your own mind about where this pandemic has been going? And as far as a lot of the people who were frankly anti-mask are now, they're the same people now emailing me about being anti-vaccine. Is that something that, as far as the anti-vaccine movement, will that be a detriment to getting everyone vaccinated?
Well, I think it will, and I'm concerned, and certainly anyone's right to not be vaccinated. But I'm old enough that I remember polio. I remember measles. We eradicated those through vaccination. People still don't want to do it. Throughout the world, we push to have people vaccinated for measles, and that's just another step in trying to make the world healthier, to curb a pandemic that, frankly, when it's my turn, I want to have it. And I have a hard time understanding in my own mind why people wouldn't want to be vaccinated. The science is there. They've tested it. It works. It's like a flu shot. Some do, some don't. And I just would encourage everyone to really give it a lot of thought, and no one's making you do anything. It's not trying to take freedoms away from you. We're not forcing the world's not forcing it on you. But I would hope that people would volunteer to, when it's their turn, to step up and take it and help protect their neighbor from it moving from person to person.
And if I can follow up with Dr. Carroll, you mentioned today hospitalizations. I think you said 67, and there's been, so to speak, a breakdown in terms of new infections. Are we still dealing with that surge from November at this point? And it's got to be emotionally draining as it already has been for the caregivers. It doesn't seem like they have gotten a break.
Yeah, great question. The number of cases that we see, or the number of hospitalizations we see, we know take time. That doesn't happen immediately after infections, and it's what we call a lagging measure. And so that's what we're seeing. And there's no question, this is difficult for the caregivers that are coming in. those that are working mandatory overtime or volunteering consistently for extra shifts. More challenging than that, however, is as I go into the ICU and I talk to Dr. Ferguson, or I talk to the nurses in the ICU to ask them how they're doing. I can see it in their eyes and in their voices what they tell me, how difficult it is when they lose patients. Our caregivers care about each patient they're taking care of. This is more than a job for them. This is something that they chose to do with their life, and this is something that they genuinely care about the patients that they're taking care of. So when they have a patient come in that, despite their best effort, despite trying everything that they can, that they see a patient that had years of life left succumb to this illness, that's more difficult than the high census. That's more difficult than a lot of patients coming in. We want to prevent the devastating effects. We want to prevent death. We do it to some degree in the hospital. Collectively as a society, we do it much better by preventing illness than when the patient ends up in the hospital. And again, my thanks and gratitude to the community that did choose to celebrate the Thanksgiving season with their immediate family under their household rather than their extended family or friends. It did make a difference. We see that. And doing the same thing for Christmas will make a difference. I will be doing that in my family, and I would ask you to join with me as we do that. This won't last forever, but it will last a bit longer.
And Dr. Carroll, one more quick follow-up, and I want to go on the positive side here. When you mentioned about seeing in the caregiver's eyes when they lose a patient, what about those times when a person's being wheeled out, they're heading to the lobby, they were at one point in the ICU, they were at one point on a ventilator, and they're leaving the hospital? Tell me about the emotion of that situation.
Yeah, we had a couple in the hospital a couple of a month or two ago, and one member of this couple, one individual, did not survive. The other did. The other left the hospital, and several weeks or months later had a significant life event. When the caregivers found out about that, the way that they celebrated, it was as if it was their own family member they were celebrating with. They had created a connection with this individual. They had created a connection with this family, and those successes are something that helps keep our caregivers going.
Thank you. And I think Christina Flores has a question. You know what? She responded in the chat that she had to step out and leave. So if there's no further questions, we'll go ahead and wrap up today. All right. Thank you, everybody, for joining us. We will go ahead.
Thank you all so much.
Thank you. Honored to be here.
We'll go ahead and process the video and get it out to everybody. We've also got some. I'm sorry, was that someone? No? Okay, we'll go ahead and get the video processed, as well as we've got some B-roll and some other photos that we'll be sharing as well afterwards. So
thanks everybody.
Thank everyone for joining us.